This morning, Port Moresby residents, business houses, NGO and state agencies gathered at the Unagi Oval to march the HIV prevention walk. The march began at the Unagi Oval and followed through to Waigani Drive along to 4 Mile and ended at the Jack Piddick Park. This falls in with this year's theme, Hands Up for HIV Prevention. In combating HIV and AIDS, the Health Department has come up with a 5-year implementation plan taken out from the WHO Health Sector Strategy that will be rolled out next year. This activity is captured in the new HIV Strategy Plan 2017 to 2022.
As of the end of the last estimation and projections exercise we've done in June this year, we can release to the public now that we have over 40,000 people alive and living with HIV in this country, in Papua New Guinea. Of those, around 23,000 people are on treatment, accessing treatment and are alive and well.
According to Dr. Dala, children diagnosed with HIV are close to 2,000. Most of this is from vertical transmission or through parent to child. He said it has dropped as part of the sustainable goals, with improvement from 43% from 2 years ago to 63% this year. Dr. Nigdala says they're taking a fast-track approach or 1990 approach.
Out of this 90% of people living with HIV in the country who has done a test, 90% of them must know the results. If they are positive, must go on to treatment. So we must put 90% of people onto treatment, those who are positive. Of those who are positive and 90% on treatment, 90% must achieve a viral load suppression, which means that the level of virus in the blood or body is beyond the level of below the level of transmission, which means it's an effective way of prevention as well.
Dr. Dala said NCD and most of the Highlands provinces are burdened provinces with a prevalence of over 1%.
Basically, in NCD, the HIV prevalence is close to 1.3%. In Jiwaka province, it's close to 1.5%. In Enga province, it's around 1.7%. And most of the islands provinces, the prevalence is over 1%.
Meanwhile, when asked if the country has enough antiretroviral drugs to provide treatment for rural centers, this is what Dr. Dala had to say.
In countries over 2 years supply in country, the only issue was about the test kits, which for some time we ran out of test kits, but in the first week of November, test kits has arrived, and beginning 22nd of November, test kits have been shipped already to the provinces, so people can now access testing services with test kits available on site.
Merlin Daukatam, National EMTV News.